I have to tell you something most people won't admit. I've seen brilliant nursing students fail the NCLEX, not because they didn't study, not because they didn't care, but because they believed 3 dangerous myths about the exam. And these myths hold you back, silently. They make you nervous, second-guess yourself, and fall into traps the test sets up for you. In this video, I'm going to show you the 3 biggest NCLEX myths that could destroy your chances and how to break free from them. And I'll teach you exactly how to think through them step by step. Stay until the end, because the last question is one of the toughest and most important ones, and I want you to write your answer in the comments when we get there. Let's dive right into myth number 1. You have to answer every question perfectly to pass. Wrong. The NCLEX is not about perfection. It's about consistency and showing that you can think like a safe, competent nurse. Let me show you with a question how this myth can trip you up and how to avoid it. Here's your first question. A nurse is caring for a patient who is post-operative from abdominal surgery and suddenly reports shortness of breath and chest pain. The nurse suspects a pulmonary embolism. What should the nurse do? Select all that apply. The options given on the screen are: Option 1, apply oxygen via nasal cannula. Option 2, place the patient in high Fowler's position. Option 3, start chest compressions immediately. Option 4, notify the healthcare provider. Option 5, prepare to administer a prescribed anticoagulant. I will give you some time to think, so you can now pause. Okay, let's break this down and watch how I use the strategy of prioritizing immediate, appropriate, and safe actions, not chasing perfection. Option 1, apply oxygen via nasal cannula. Yes, correct. The patient is likely hypoxic because of the pulmonary embolism blocking blood flow in the lungs. Oxygen helps improve oxygenation. Option 2, place the patient in high Fowler's position. Yes, correct. Sitting upright allows for better lung expansion and oxygenation. Option 3, start chest compressions immediately. No, incorrect. The patient is still awake and talking, so this is not cardiac arrest. Starting compressions here would be inappropriate and even harmful. Option 4, notify the healthcare provider. Yes, correct. This is a medical emergency, and the provider needs to know right away to order tests and treatments. Option 5, prepare to administer a prescribed anticoagulant. Yes, correct. Pulmonary embolisms are usually treated with anticoagulants to prevent more clots. Preparing for that medication is appropriate. Notice here how I didn't look for a perfect answer. I focused on the immediate, safe steps that address the patient's airway, breathing, and circulation first, then notifying the provider and preparing treatment. That's how the NCLEX wants you to think, and that's how you avoid myth number 1. Now, myth number 2. If you get more questions, you're failing. Wrong again. Many students panic when their exam keeps going beyond 75 or 85 questions. But more questions just means the test is still figuring out if you're above the passing standard, and you can still pass.
Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and, most importantly, help you feel more ready. Good luck. You've got this.
Here's a hard question to help you practice staying calm under pressure and thinking clearly, even when it feels like you're failing. Here's the question. A nurse is caring for a patient with syndrome of inappropriate antidiuretic hormone secretion, also known as IADH. Which interventions should the nurse implement? Select all that apply. The options given on the screen are: Option 1, restrict the patient's fluid intake. Option 2, monitor for signs of hyponatremia, such as confusion or seizures. Option 3, administer hypotonic intravenous fluids as prescribed. Option 4, weigh the patient daily. Option 5, encourage the patient to drink at least 3 liters of water per day. I will give you some time to think, so you can now pause. All right, let's work through this one together, using the strategy of focusing on what the condition actually does and ignoring the panic of too many questions. Option 1, restrict the patient's fluid intake. Yes, correct. IADH causes water retention, so we want to limit fluid intake to prevent further dilution of sodium in the blood. Option 2, monitor for signs of hyponatremia, such as confusion or seizures. Yes, correct. Because of water retention and low sodium, the brain can swell, causing confusion, seizures, or even coma. Monitoring for those signs is crucial. Option 3, administer hypotonic intravenous fluids as prescribed. No, incorrect. Hypotonic fluids would worsen the water overload and lower sodium even more. Instead, hypertonic fluids may be ordered in severe cases. Option 4, weigh the patient daily. Yes, correct. Monitoring weight helps track fluid retention. Option 5, encourage the patient to drink at least 3 liters of water per day. No, incorrect. That would worsen the problem of water retention. See how I thought here? I didn't let the extra question numbers scare me. I calmly asked, what's the problem? Too much water. What's the priority? Get rid of excess water and protect the brain. And that's how I avoided myth number 2. Now, myth number 3. The harder the question feels, the worse you're doing. Nope. In fact, the NCLEX is adaptive. When you're answering correctly, the questions get harder because the computer is testing your upper limits. So here's a really hard, confusing question, and this is where you prove you can think critically. Here's the question. A nurse is caring for a patient with acute respiratory distress syndrome, also called ARDS, on a ventilator. Which action should the nurse take? Select all that apply. The options given on the screen are: monitor for signs of barotrauma, such as subcutaneous emphysema. Option 2, position the patient prone as prescribed. Option 3, maintain a low tidal volume setting on the ventilator. Option 4, restrict the patient's protein intake. Option 5, assess for hypotension after increasing positive end expiratory pressure, or PEEP. I will give you some time to think, so you can now pause. Okay, let's figure this out together. Notice how I stay calm even when the question feels hard. That's how I avoid myth number 3. Option 1, monitor for signs of barotrauma, such as subcutaneous emphysema. Yes, correct. Correct. ARDS patients on a ventilator with high pressures are at risk of barotrauma, air escaping into tissues, so we watch for swelling under the skin and sudden respiratory distress. Option 2, position the patient prone as prescribed. Yes, correct. Prone positioning improves oxygenation by opening up collapsed alveoli in the back of the lungs. Option 3, maintain a low tidal volume setting on the ventilator. Yes, correct. Using lower volumes helps protect the lungs from further injury, called lung protective ventilation. Option 4, restrict the patient's protein intake. No, incorrect. ARDS patients need adequate protein for healing and preventing muscle loss. We don't restrict protein. Option 5, assess for hypotension after increasing positive end expiratory pressure, or PEEP. Yes, correct. High PEEP can reduce venous return to the heart, causing low blood pressure, so monitoring for that is essential. See what I did? I didn't panic when the question felt hard. I remembered. If it's hard, that means I'm doing well enough that the computer is testing my critical thinking. I focused on the pathophysiology and chose answers that made sense for protecting and supporting the lungs and the patient overall. And now, it's your turn. Here's the final challenge question. I won't give you the answer this time. I want you to write it in the comments below. Here's the question. A nurse is caring for a patient with acute pancreatitis. Which interventions should the nurse anticipate? Select all that apply. The options given on the screen are: Option 1, keep the patient nothing by mouth to rest the pancreas. Option 2, administer intravenous fluids as prescribed. Option 3, provide a high-fat, high-protein diet. Option 4, manage pain with opioids as prescribed. Option 5, encourage the patient to drink plenty of water to stimulate pancreatic enzymes. Pause here, think carefully, and drop your answers in the comments below. Here's a hint. Think about resting the pancreas, supporting the patient's circulation, and managing pain. I'll pin the correct explanation at the top of the comments, so make sure you participate. Remember, the NCLEX doesn't just test what you know, it tests how you think. And those 3 myths? Forget them. You don't need to be perfect. More questions doesn't mean you're failing, and harder questions mean you're doing better, not worse.